I'm Dr. Jeff Borenstein, editor of Psychiatric News. I'm here in Atlanta at the APA's annual meeting, and I'm speaking with Dr. Maria Oquendo, the incoming president of the American Psychiatric Association. Maria, thank you for joining us.
Thank you. It's a pleasure to be here.
What's it been like for you to serve as president-elect and get ready to serve as the president in the upcoming year?
Well, I'll tell you, the year as president-elect has been incredibly exciting, and the learning curve is shockingly steep. So I've had to learn a lot about all of the different parts of the association that work so well together to make a difference for our members and our patients every day. It's really been a fantastic experience, and working with Renee Binder has been really fabulous.
What do you see as the key goals that you have during your presidential year?
So I'm thinking about a couple of things. One of the things that I'm interested in doing is starting to develop closer relationships with other specialty groups in medicine, because I think that we have an opportunity for prevention in psychiatry, and really we can't do it by ourselves. So doing things like, for example, getting involved with the College of Obstetrics and Gynecology to work together towards identifying women in the peripartum with depression so we can treat those women. Or working with pediatricians to see if we can't figure out a system to have mental health education and screening in waiting rooms, and also education about child rearing and limit setting for children. So those are some of the things that I think we could do in partnership with other associations. In addition, I think it's going to be a very interesting year, if I get my wish, to start internationalizing the association a little bit. So for example, at the Research Colloquium for Young Investigators, we are piloting a program in which we've linked with the Biological Society meetings of France, Spain, Colombia, and Brazil. And each of those associations have sponsored a young investigator from that country to come to our meeting and to come to our Research Colloquium. The idea is that in the past you could have a national network and be a very successful researcher. But that's not going to be the case in the next 5 or 10 years. You're really going to need to have an international network. And this could be, if you will, the seeds of developing international networks for our APA members and also for these young investigators who are coming from other countries.
The world is getting smaller all the time.
Absolutely.
And it's important for us to have our place in getting the word out and helping people interact.
Absolutely. Well, the other thing is that because of the APA's stature, not only is it the oldest psychiatric organization, but it's the largest one. Really, my experience has been that other psychiatric organizations around the world see it as a model. And I think that extending our hand across the ocean or across the equator is going to be a really important way in which we can develop some excellent partnerships and help psychiatry, not only here in the US, but globally.
You've dedicated much of your profession to training the next generation of psychiatrists. I'd like to ask you about APA and our younger members.
The younger members are absolutely essential members of the organization, in particular because they're our future. And so I've been very excited to get involved with the resident fellow members and do things like, for example, go to the residents' journal meeting on Tuesday and make a point of visiting with these young residents who are getting involved with the organization and supporting their engagement and encouraging them.
Finally, I want to ask you about another issue that I know is important to you, which is suicide prevention.
Yes.
And what you see in terms of the role of the APA on that important issue.
So I think that the APA can be very instrumental in educating people about suicide, not only at the public in general, but importantly in terms of our government and through our government relations to try to work more closely with representatives in the House, with senators, to support them in their efforts to bring legislature that will save lives.
Good. Well, thank you very much for what you've been doing. Thank you in advance for the upcoming year, and I'm looking forward to seeing all these results.
Terrific. Thank you so much, Jeff. Always a pleasure to talk to you.
Good.
Thanks.
Thanks.